Hello again, and welcome back to the Reap and Rise Roadmap. You've optimized your calendar. You've set boundaries at work. You've hired help, and you're doing everything you have learned about productivity. So why are you still exhausted? I'm Dr Catherine Muyeba, lifestyle psychiatrist, ADHD and addiction specialist, and I work with professional women who are absolutely brilliant at managing their careers but feel burned out despite doing everything right. And here's what I discovered. Burnout isn't just about workload. And by that I mean you can fix your calendar and still feel depleted. You can take a vacation, you can come back just as tired, because burnout isn't only created at work. There are hidden sources of burnout that professional women are carrying silently. And that's what I'm naming today, 7 of them. And I'm telling you why I'm starting this series with the one that's most difficult to talk about, because it's been hiding in plain sight. When we talk about burnout, we default to work. Too many meetings, impossible deadlines, overloaded schedules, and yes, that is real. But here's what I see in everyday practice. Women who have mastered their professional lives are drowning because of what's happening outside the office. Perhaps the relationships that's slowly breaking them, possibly the parent who needs constant support, maybe the child struggling with addiction, and perhaps undiagnosed ADHD that they've struggled with for decades, and also financial pressures that no one knows about, and then the physical health issues they keep postponing, and then lastly, the spiritual emptiness they can't quite name. So let me ask you something and answer this honestly. Which one of those 7 did your body react to? Did you feel something in your chest tightening a little perhaps? Did you feel that quiet, oh, that's me moment? And if you did, just nod where you are. These aren't small things. These are emotional loads you carry in silence while everyone praises how together you are. And this part matters. If you can write this down, burnout isn't a personal failure. It's an acknowledged load, and it's very common. And why is that important? Because you can't heal from burnout. You're misidentifying where it's coming from. I want to name 7 sources of burnout that have nothing to do with your work calendar. As I name these, don't diagnose yourself. Just notice which one costs me the most energy to manage. So number 1, relationship stress. That partnership that requires constant emotional labor. The conflict you're always managing, the loneliness inside a committed relationship. And that means your nervous system never truly rests, even at home. And number 2, caring for somebody with addiction. This is the one that we are diving into in this series. Loving someone who is struggling, be it a partner, a parent, a sibling, a child, or colleague, is one of the most draining experiences a woman can carry. And we carry it quietly. And number 3 is the physical health challenges. The chronic condition you manage alone, the pain you've normalized, those appointments you keep rescheduling because work needs you. And number 4, mental health struggles, the anxiety that never fully turns off, depression that you've learned to function through, and then the trauma you haven't had time or space to address. And number 5, unmanaged ADHD. For some professional women, ADHD wasn't diagnosed in childhood. You've just learned to work twice as hard. You are compensating constantly. And that level of effort is exhausting. And number 6, spiritual drought. You're disconnected from meaning or purpose. You're just going through the motions, but something essential is missing. And number 7, financial pressure. That secret debt or supporting family members. That gap between what you earn and what everyone else assumes you can afford. And if even any one of these resonates with you, you are not broken, you are not weak, and you're definitely not alone. So why am I starting the series with addiction? Because as a psychiatrist and an addiction specialist, I see just how invisible this burden is. So professional women come to me and say, I don't know why I'm so tired. Work isn't even that bad right now. And then quietly they add, my husband drinks every night. Or my sister keeps relapsing. Or my adult child is using again. So you're managing your job and your home and your reputation, and you're also managing somebody else's issues. And that looks like checking your phone before bed, listening to the opening door, reading the tone in the text rather than the words, problem solving at 2 a.m. while everyone else is asleep. Your nervous system never stands down. You're hypervigilant. You're grieving who they were supposed to be while trying to love who they are. So here's the real question. How do you love someone with addiction without losing yourself? And that's what this entire series will be about. Navigating someone else's addiction without losing yourself. From enabling versus support, to protecting your mental health, to knowing when it's time to step back. Because nobody teaches women how to do this without burning out. And here's the good news. You don't have to stay stuck in any of these sources of burnout. First, reflect. Not what should be draining you, but what actually is. For example, I'm not exhausted from work. I'm exhausted from managing unpredictability. Next, envision. What does freedom really look like for you? What does peace feel like? What would change if you weren't in survival mode? And then analyze. What patterns keep repeating? What's yours to carry and what isn't? Write this down if you can. Loving someone doesn't mean absorbing their consequences. And then plan. Not a life overhaul, but one boundary this week. One conversation you stop rehearsing. One night where you choose rest over rescue. And then you can rise, equipped, empowered, and no longer burning out in silence. So that's it for today. Subscribe so you don't miss an episode. Burnout thrives in silence. And here we don't do silence anymore. Let's do this together.